Great to be with Eric Burlison of Missouri. And Congressman, it's a pleasure to see you. The last time we were here on Capitol Hill, we had a great conversation. And I won't lie, you didn't have a really rosy forecast at the time about where things were headed.
Okay.
How do you feel today?
Look, I think that we have passed a great bill in the One Big Beautiful Bill, had a lot of the tax reforms that we needed to address, but we did not take on the topic that I was harping about to our conference, which was healthcare.
Yes.
And the affordability crisis
And
is
here we are.
staring us in the face. And I think we will fail the American people if we don't properly address it.
And so to that end, you do have a plan. I mean, while everybody else says we've got to do this, we got to do that, you've put it down on paper.
Yeah.
What do you think?
I've architected a plan. I took a lot of the best ideas from other members in the past, right? Some of the bills that really, I thought, kind of shepherded us back to a free market, and took the best of those ideas, put it together, and added a few of my own. And I call it the MAHA Plan, or the MAHA accounts. So the idea is you let people keep, if they, don't touch the other stuff. Obamacare, leave it alone, right? If people like their crappy Obamacare, they can keep it. They can truly keep it. But we're going to give people a better product in this MAHA account. So instead of you buying insurance through your employer, for example, your employer writes the check to your MAHA account. And you can put in your own money tax-free into MAHA. You can get charitable donations or maybe government help into your MAHA account. And then you get to go out on the insurance market and pick whatever insurance policy you want. Maybe you want a health sharing ministry policy. Maybe you want an association policy. Maybe you want a state-sponsored plan, or God forbid you want the ACA, you can have that. But let people pick and pay the premiums for the product that they want. And guess what happens when you do that? You get to pick your network.
Yes.
You get to pick your doctors and which doctors are in the network or what hospitals are in your network. If you want to do direct primary care, you can do that. You also would be able to pay for deductibles tax-free. You'd be able to pay your co-pays tax-free. And so I think this idea is gaining speed. And then one of the ideas that, in conversations with the Bobby Kennedy team, it really is about, we got to address the healthy issue in America, not just health care costs. And so the American people are not healthy. The food that we're eating isn't healthy, and we end up paying for it on the back end with expensive medical bills. Why not flip the script and reverse that? Why not encourage people through their MAHA account each month to be able to purchase healthy food, right? Mm-hmm. And I mean unprocessed protein, produce, basically meat, vegetables, vitamins, supplements, things like that.
Using the tax code to encourage behavior like we have in the past.
That's right.
Having a family. Yeah.
That's right. And so that's something that at the end of the day, wouldn't you love to be able to buy your steak tax-free?
I love the idea. Yes, I'm all for it. Tax-free. Market-based solutions. You're offering them. We need more of it. I mean, you're here to solve problems. That's what you're clearly passionate about doing.
Yeah.
And I know you got to go vote, but I wanted to talk to you before we left because I love this plan. How likely is it we're going to get somewhere with it?
I've had a lot of conversations with leadership and with members of the committees. We're gaining steam, and I just need the American people to reach out and kind of, if they like this idea, get behind it.
It's called the MAHA Plan. Can people read more about it? I'll put it up on
my social media. We're
good.
tweeting about it all the time.
I will repost on my social media to people that are listening if they want to follow along. Eric Burlison's plan, the MAHA account plan. Congressman, great to talk to you. Thanks for making time.
Good to see you again, Chris.
We'll see you soon. Merry Christmas.
Merry Christmas to you.